So this is what I actually typically see is it's the young girls who don't eat enough iron and are not aware of that, okay, I lose my iron, I have to fill it up.
Yeah.
And actually on the other spectrum, I have the ladies who are 40 plus, towards the end of what we call the fertile cycle of life, and not in the menopause yet, but usually around that age, 40, 45, the menstrual cycles become different. And for some women, they actually start bleeding more.
Okay.
And before you know it, all of a sudden they feel so tired and they think, is this menopause? Am I stressing too much? This and that and this and that and this.
Yeah.
And sure, life has its stresses, but you should check that out. What does it look like? You're bleeding contra, what's your blood count?
And that's what I talk about constantly on this channel, to not suffer in silence. Go for an actual checkup, speak to your GP, find out why you're so tired, why this is all happening in your body. Hello ladies, and welcome back to my channel. My name is Aisha, aka Nurse Aisha. I'm a registered nurse here to spread awareness on preventative health and lifestyle choices for women. That is my focus, so you can lead a healthier and more informed life. Welcome back to my channel. For those of you that are not subscribed yet, make sure that you subscribe right now. Do it, please. That helps me to create more material for you guys that you can enjoy, learn more about your own health. All right, so for those of you that have been watching me, you know that a while ago, I put out a video regarding my own health journey and the 4 different diagnoses that I live with every day. So I explained a little bit about those conditions and how I treat them and how I actually came to get diagnosed with these different conditions. So today I want to bring to you dive a little bit deeper into one of the first conditions. Now, I have invited a good friend and a former colleague of mine, Dr. Anna Drake. And today, we're gonna talk to you about anemia, more specifically, iron deficiency anemia that I live with on a daily basis. For those of you that haven't watched that video about my diagnosis, I will link it up here so you can watch that video. Dr. Drake is a very special friend of mine. We've worked together, so I know her work. I know how she really fights and takes care of these patients. Obviously, she treats patients with all types of different diagnoses, but she has a special kind of love and affection to patients, especially young women that come to her with iron deficiency. So today we're going to explain a little bit more about anemia, the physiology behind anemia. We're going to talk about the causes, the risk factors, symptoms, as well as diagnosis and treatment. So make sure that you stay tuned and please welcome Dr. Anna Drake. All right, Dr. Drake. Thank you for coming.
Thank you for having me.
Before we get into the conversation, I would like you to introduce yourself a little bit more to the audience, because I did a little bit of an introduction just as a general practitioner, but I know that you've done more.
Oh dear.
And you do more, right? So please introduce yourself a bit more.
Well, to make a long story short, I am a medical doctor, trained here in Sweden primarily. I trained in Stockholm about roughly 30 years ago.
Yes.
Once, long time ago, I didn't think I was going to be a general practitioner, so I have worked within other fields of medicine, primarily within anesthesia and heart diseases also, and what's called physiology.
Yes.
But roughly 30 years ago, is it? No, 20 years ago, I got into the path of being a general practitioner, which is family medicine in some countries, or your GP in Great Britain, for example, and that's what I've been doing since. I've been a specialist for a bit more than 10 years now.
Okay.
I am, well, how far should I go? I'm a mother of 3.
Yes.
They're all growing up now, they're teenagers.
Yes.
I'm married, I live in the north of Stockholm, and I work in the north of Stockholm as a GP too.
Yes. And then you have a family that is also in the practice, basically? Your father?
My father was may he rest in peace, a gynecologist.
Yes.
He was one of the people who brought me here. My parents were both doctors.
Yes.
So he was actually working in the north of Sweden. Everybody knew him.
Yes.
My father was from Ghana. And
Yes.
we came to Sweden with my family in the mid-70s. And so living in the north of Sweden in the mid-70s, my dad and my mother working in the hospital there, and there were not many black people around at that time, so everybody knew him.
Yeah. It's a long history of family being in medicine.
Yeah, my mother, I have a brother too who's in medicine, and a number of other relatives, both in Sweden and abroad, who are doctors too, yes.
Yeah. I remember you telling me about the story with your father being such a big man and having this practice in the north of Sweden where not many people were used to having a black man being high up in.
Well, I could say that in the hierarchy, in the sense that he was a doctor, and that brings a certain degree of, I would say, respect, being an immigrant primarily.
Yeah.
But we actually came to Sweden that was very welcoming.
Yes.
Very kind. One of the reasons we moved to the country was that both my parents, it was what people call an interracial relationship. My mum's from Poland.
Yeah.
They experienced that people were kind and not especially racist, I would say, maybe curious, and sometimes maybe there was a bit of ignorance, but definitely with a heart in the right place. And they felt very welcomed, and there was good childcare. You don't find that everywhere. Good schools. A good living standard, and the work that was needed, and they loved doing what they were doing in the north of Sweden.
Yes, and you inherited this. Not only this, not only the job or the career, but you also inherited the language. Because when I was working with you, we used to work together, and you speak Polish. Yeah, and I remember Polish people coming to you, just because of the language barrier and the cultural meeting with a doctor. I found that really, really interesting. So you speak Polish and you can practice in Polish.
Well,
basically.
I learned the hard way, because studying medical language is not really your everyday political language. So the Polish you use with patients, I didn't learn that at medical school. So I had to learn it from my patients, really, because that was nothing we used at home. But it's given me yet another aspect that is kind of blesses my work. I have a fantastic job, and I can also help these people who maybe don't speak so good Swedish. Yes. And there's a cultural aspect to it of understanding Polish people, but at the same time, people's bodies are the same. So everyone's got 2 arms, 2 legs, a brain, eyes, mouth, a soul. So we're all people. Yeah.
I have to say, I had to highlight that I loved that, and these patients really appreciated you meeting them in where they were, and also being able to speak the language that they understood when they were in hard times, basically coming in sick. So we're gonna get into the topic. We're here. I asked you to come here, and I asked you what would you like to talk about, and it was anemia. And funny enough, or coincidentally, that is one of the conditions that I have and live with on a daily basis, and something that I talked about in a video prior to this one. So we're going to talk about a little bit more about anemia. So the first question is, please explain the physiology of anemia and the different types of anemia.
Well, anemia is, in my world, very simple. It's that you don't have enough red blood cells.
Yes.
Now you can say red blood cells, what do we have? Oh yeah, we have primarily 3 different kinds of blood cells. It's the red blood cells, it's the white blood cells, and it's the platelets.
Yeah.
Our blood is red because of the red blood cells. Now, those are the cells that will carry specifically, apart from nutrients, they will carry your oxygen that you breathe in every day. They carry it around your body, and the leftover product, the carbon dioxide that goes back to your lungs, they carry it back. The red cells, when they are depleted or you don't have enough of them, that's when you have anemia. It's a very common ailment. Many times you can have anemia without knowing it.
Yes.
But primarily you need red cells to grow, you need red cells to have energy.
Yeah.
And there's always a constant turnover of red cells. New ones are made, old ones are shed. They have a shelf life, you can say.
Yes.
But if you don't have the nutrients in your body to build these red cells, then that shelf life, slowly you'll have less of these cells. So because there's a constant turnover, you mean one cell is made, it's there for 10 days or more, a month, and later on you have to have new ones that the body produces itself. For that you need nutrients, and very much so you need iron. Red blood cells are red because the iron gives a red color.
Yes. So that is the basically iron deficiency that you just explained, but there's other types of anemia. Yeah. Just
definitely. You can have anemia because of lack of other nutrients, primarily B vitamins.
Yeah.
You can have anemia also because just as you have the turnover of those cells, you may lose them. So you lose them. That's one way of getting anemia. If I bleed, I get a sore, blood runs, and the sore is healed, but I've bled a lot.
Yeah.
Then I will have less blood cells than I had from the start. So obviously that's a way of getting anemia. If I don't produce enough red cells because I don't have B vitamin, or there's something wrong with the mechanics of producing it, because red blood cells are made in your bone marrow, inside your body. If that doesn't work out, you get anemia. Then there are also conditions, sicknesses that will give you anemia, like, for example, a general inflammation. A general inflammation you can find sometimes when you have cancer. Sometimes you'll find it because you have rheumatic disease. That is a typical condition that gives you low blood count or anemia. So diseases, of course.
Yes.
Certain cancers give it to you. And then actually one specific that is known among several of countries, for example, in Africa and in America, North America, South America, is sickle cell disease, which is a kind of a plastic anemia. A plastic anemia is a typical kind of disease. There's several kinds of plastic anemia where the blood cells are somehow destroyed or don't function the right way.
Yeah.
And sickle cell is one of them, where you will have red blood cells that are formed in a slightly different way than the round usual ones. They're formed like a sickle. That's right. But then they don't function the way they do, and they break down and destroy quite quickly.
All right, so now that we have that out of the way, what can cause, we basically got through the causes and what are the risk factors then? Do we have any risk
factors? With anemia itself, what's the problem?
Yeah.
Well, it depends. You can have the different kinds of anemia, as I just told you, and in my daily work, the most common form of anemia that I find are the people who actually don't get enough iron or B vitamin in relation to also if they lose blood.
Yeah.
And what I'm trying to get to is actually women in what we call fertile age who every month will shed blood with their menstruation. They will, and that has to be repleted. You have to get it back again. So how does that? Well, the body will normally make blood as you lose it, because it has the mechanism is when you have anemia, it will actually start making new blood cells. It will take whatever iron you have in the body and the nutrients and make new blood cells.
Yeah.
But sometimes, if you're a woman and you bleed every month, the body just doesn't catch up because it doesn't have enough iron. Once
heavily bleeds.
Yeah, heavy bleeds. But actually, it can also be so that you are a young, one of the typical things, you're young, you're maybe 15, 16, 17. You have your menstrual bleeds every month, and you maybe don't bleed that much. But frankly, when you look at your diet, do you eat enough iron?
Yeah.
And you think that, I get a bit of it, but it's usually, I wouldn't say usually, but commonly, it may not be enough to replete the iron you need, because not only do you need iron in those red blood cells, but you actually need iron for other functions in the blood too, in the body, other functions in the body too. So we actually have a reserve of iron. Normally you should have a reserve of iron. It's usually mainly set in the liver.
Yeah.
So when your red blood cells are gone and the body needs to make those red blood cells, it will take from your diet, but a lot of it will also come from your liver. You build up a reserve of iron in your liver. But if you're always eating from that reserve in the liver and you're not filling up with that food, sooner or later that iron runs out.
Yeah.
And your blood cells become small, 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 small. You can actually see it on the values we take when we take the blood tests.
Counts, yeah.
And you see not only do you have low blood count, as we say, but the cells are small.
Yeah.
Because they've got a hunger for iron.
Yeah.
So this is what I actually typically see is it's the young girls who don't eat enough iron and are not aware of that, okay, I lose my iron, I have to fill it up.
Yeah.
And actually on the other spectrum, I have the ladies who are 40 plus, towards the end of what we call the fertile cycle of life, and not in the menopause yet, but usually around that age, 40, 45, the menstrual cycles become different. And for some women, they actually start bleeding more.
Okay.
And before you know it, all of a sudden they feel so tired and they think, is this menopause? Am I stressing too much? This and that and this and that and this.
Yeah.
And sure, life has its stresses, but you should check that out. What does it look like? You're bleeding contra, what's your blood count?
And that's what I talk about constantly on this channel, to not suffer in silence. Go for an actual checkup, speak to your GP, find out why you're so tired, why this is all happening in your body. That's a really good way, because I know when we spoke on the phone, you talked to me about these young women that also other doctors don't pick up on their iron deficiency or their low blood counts, and then they are sent back to you for really something that they could have fixed in no time. But what happens, just to be the devil's advocate, it's just that when they actually show up, it's kind of, they're in an emergency hospital, and usually those people, 'cause I've seen this, usually what they say is, this is not our problem, this is an emergency hospital, this is something that you can fix at your GPs, and then they're bounced back to you guys.
Well, it's just anemia. But anemia in our world, in the Western world today, it doesn't kill you. But the quality of your life is much worse.
Yeah.
I often reflect over the fact that children, youngsters, but also grown-ups who have anemia, I mean, when you're tired in that way, your brain doesn't work the normal way. There are studies that show you that children with anemia, they are stunted, as we call it. They don't grow as well as children who have a normal blood count, normal iron levels. So not only does the body not grow as well, the brain doesn't grow as well. All these small things that are subtle, but it affects you as a person.
Okay, also, so we're gonna switch a little bit. Okay, so what is the problem that it's not really accounted for? Because I feel with women's health, do you think that is a problem, that it's women's health, so it's not really, it doesn't really count that? It's not prioritized. Do you think that's a problem?
I would want to say that we are all women. We all, during some part of our life, a large part of our life, we bleed.
Yeah.
Somehow I have this, it would be a mission to tell all mothers today, the daughters you have, teach them. Because how is it? We've been women for ages, but we don't, from generation to generation, teach our children. We don't need someone to tell us, really. Of course, it's good if the health system supports it. You go to the emergency and they say, okay, this is not an emergency, you go to your GP, but this is important. That's true. It could be so that because it's a woman's thing, it could be so because it's not an acute, it doesn't kill you, and because it's a matter of, say, nutrition, that one kind of doesn't stress it much enough to the patients. But at the same time, I feel that we have to educate ourselves as women and tell each other that, my daughters, tell them when they have their menstruation, you have to fill up with iron. If you bleed a lot, we have to do something about that.
Yeah, and that's what we're here. Educating. So in my case, so what happened to me is that I got contraceptive that led to my heavy bleeding, and then I got anemia. I learned the hard way. So I'm here basically so that no one has to learn the hard way. What is wrong with that system where contraceptives or other methods are not really like accountable that this could cause anemia, for instance?
Well, in this respect, I would say that the person who gave you the contraceptive should follow up. Because some people who bleed a lot do get contraceptives to bleed less. And that's the exact thing you want to happen if you have a lot of bleedings.
Yeah.
But some people don't bleed less, some people bleed more, continuously, every third day, or just a little here, a little there. You have to have a good follow-up. And there, the fault lies not with you as a patient, because how can you know? It should lie with the person who gives you the contraceptive to check out, okay, 3 months have passed, how are you doing? Oh, you say you're bleeding, let us check your blood level, your hemoglobin.
I mean, I didn't even wait for the follow-up. I don't even think I was booked for a follow-up. I called for my follow-up.
But that's exactly what I mean. We're expected to know what results to get.
Yes.
Either you have to be informed that this is given to you now. If this happens, do come back
exactly
at once, because you are not to bleed this much, for example.
I don't think I got that information.
No, and that's definitely, I would say that's a problem, yes.
Yeah.
And I think that, sadly enough, still happens today. We have a lot of good medical care people who do follow up.
Yes.
But once now and then, I do see, and if you as a patient are not aware of the dangers, then you have to be informed about it. And I think that information is not given, not much enough, no.
Yeah. All right, so let's go to symptoms and diagnosis. What is the common symptom that you see when patients come to you?
The most common symptom is tiredness, of course.
Yeah.
So many people come to me with tiredness for other reasons, but this is definitely a reason to give you tiredness. So if somebody comes to me with tiredness, it's not the first, but one of the first things I do check, just in case, in particular with women.
Red flag.
Yes.
If you're tired. I was tired constantly. I talked about this in the video. I was so tired, I would fall asleep going to work, like on the bus. I would fall asleep during work. I would definitely need a nap. I thought, I was so tired, I couldn't cope with my work or something. But really, it wasn't that. I even thought that something was wrong with my sight because I had that blurred vision.
Yeah.
It was really, really bad. And so what is the acute symptom that you would tell people to look out for?
Well, that kind of sleepiness or tiredness, that you fall asleep in situations when most normal people wouldn't do that. You're sitting I know of sitting at the cinema, you watch a film, as soon as the lights go out, you're off. Now, who does that? Okay, once in a while, but continuously not.
Yeah.
Finding it difficult. I once met a young lady who said that she got chest pain when she went to her gym to do the things she normally did. And that's not normal for a young and otherwise healthy person.
Shortness of breath.
Shortness of breath. Headaches are very, very common. I have witnessed patients coming to see colleagues who were told to go home that headaches, it's not a problem, but where it was quite obvious that this doesn't make up and that person had an anemia.
All right, so shortness of breath. And so when you meet these patients, the first evaluation, you take the blood test and then you give them the diagnosis. How does that happen?
Well,
and how do they receive the information?
Well, it depends. I mean, actually, if I'm to be honest, the first thing I do is I take a proper history. That is, I have a good conversation with the patient. How long have you been tired? When do you get tired? And then I do ask them, how do you bleed? And it's not, and I can't say if it's a woman, oh, do you bleed a lot? Because most women don't know what is a lot and what is little. I mean, I don't know what my sister bleeds. I don't know what my mother bled. So I will have to kind of give them specific questions as what their bleeding is like and how many days and so on.
But I'm sure someone can tell. I mean, in my case, I remember I used to put on, like a tampon or a pad going to work. But as soon as I got to work, I had to change it. Isn't that a lot? Because I could tell that this was not normal. I think a lot of people can tell. But we normalize it, Anna. We normalize this as women.
Of course. I mean, because you just get on with life. But at the same time, I must say that some girls maybe don't bleed what we consider a lot. But then there's the other side of it. I ask, do you eat meat?
Oh, yeah.
What kind of diet do you have? Of course, if you've had any sicknesses, if you take any medication, if you take any supplements or anything else that you add to your diet.
Yeah.
Everything around your health I need to know, really. And that's why it can seem like, what does that matter? I ask questions, but it's interesting for me to get that kind of full picture of what's going on. And then I will decide, okay, I take the tests. And sometimes I need to take tests where you need to be fasting, so I'll ask the patient to come back when they've been fasting overnight and lead tests.
Yeah.
Depending on who it is, usually if it's someone I haven't met before, I quite often want to meet them again, and especially if I want to go through the issue of anemia, then I would like to speak to them in person. But sometimes it's enough that I write them a letter, often electronically, and explain the background and what I believe is the reason for this anemia if they don't have anemia.
And that's a fancy way how we communicate in this country, electronically with your patients. I'm sure that's not available everywhere, but that's available here, and we're grateful for that.
Yes.
All right, so now you've done the evaluation about the symptoms, and then you've given them a diagnosis. So now it's time for treatment. What is the common treatment?
Well, there's two ways about it. If it's just as we've been talking about, a woman, fertile age, who bleeds, then I will actually stress that there's the input and there's the output.
Yeah.
Now, if you want to continuously be giving yourself iron, then yes, let it bleed. Do you understand what I mean? That as long as you keep bleeding a lot, you're going to have to replenish the iron.
Okay, yeah.
So I always ask myself, is this something that maybe has to be managed somehow? And it can be that I say, maybe you should meet the gynecologist who will assess your bleeding, and if they can help you in any way. Sometimes we find women, for example, have fibroids.
Yeah.
That's not uncommon. That a woman, especially if you're above 30 or 40, that's when you start bleeding more. Then those fibroids will make you bleed even more, and that can be a reason to think, okay, so how do we take care of this? Will it be contraceptives? Will we be taking medication that actually diminishes your bleeding? You can get that off the counter here in Sweden. You don't need a prescription for that.
But you have to know what it is.
You have to know what it is. And I will mention that too, because that means that every time you bleed, you have your menstruation, you will take the pills so that you bleed less.
Okay.
You need to know whatever there is to stop the bleeding. In the old days, it was much more common that women who had already given birth to their children and were still of childbearing age but bled a lot, that one would do a so-called hysterectomy.
Yeah.
Hysterectomy. My tongue twister there.
Yeah.
You take the uterus away, but that's a pity if you don't. I mean, most of all, you want to keep your body intact. You don't want surgery if you don't need it.
Yes.
So one should try other ways of dealing with that.
Yes.
So that's the one part of treating it. And then of course you've got the part
the extreme part of treating it.
Well, the hysterectomy definitely.
Yeah.
But
that's due to other conditions.
Yes.
The fibroids.
Contraceptives can help. Even a diaphragm of a hormonal kind can do so. It's usually a matter of having hormones that make you bleed less.
Yeah.
But then it's the treatment, and usually, depending on what your dietary needs are and how you eat, you will need to replenish your iron.
Yeah.
And at the same time, make sure that you have enough B vitamin, because it's not uncommon that if you have too little iron, you also have too little B2 and folate, or folic acid as we call it too. Yeah.
Which should we all?
B12, sorry.
Should we all take folic acid as women? Because a lot of people ask me that. I mean, when do you start?
I think that you have to be a bit more cautious about that, because you don't need as much as usually one doesn't need to replenish it every day.
Yeah.
It's not that kind of vitamin, the folic acid. And you also have to be careful if you want to have children. Previously, we had fortified food here in Sweden, both iron and B vitamin. And I think there was a folic acid I'm not sure about that, but I know that was taken away, the recommendations to take folic acid, because it does have implications if you want to bear children, if you get pregnant, and it's not recommended then. Okay. So you have to be careful about the folic acid. But B12, well, if you have a full diet, you eat not junk food, but actually you eat your vegetables, you eat your beans, your fruit, a bit of meat, fish, cheese, dairy products, in moderation, of course, with those, but especially the vegetables.
The green
and the greens and the grains.
Your spinach, your broccoli,
and your grains.
Yeah.
That is the best way to get your B vitamins, really, because not only do you get the vitamins, you actually get all the other small nutrients that you don't get with that tablet, which is just B12. So that should be the first ambition to do that. But,
we talked a little bit about the treatment off camera, and I shared with you the first treatment that I got, which is the common tablets, and that didn't really work out for me. I got symptoms, with constipation, and I wasn't told that we needed to take this with C vitamins. So I was questioning if my body actually received this, if I actually could take the iron into my body. So I quickly stopped that. Well, not because I didn't know if actually worked, but because of the constipation issue. And so what do you advise your patients to do?
Well, I do advise them, because that is really a problem with the iron tablets, is that some people get bloated, but most people get constipation, and that means that it's just difficult to keep up the medication. So that's what we call compliance as doctors, and compliance is that you actually take the medication the doctor tells you to take, and it's going to help you out. So of course the best thing is the diet.
But if it doesn't,
but the tablets, I sometimes actually prescribe medication to help you not become constipated at the same time, or I give advice and I stress that this makes you constipated, so please take caution in what you precaution, whether it's taking the medication for constipation or eating such things that will help your bowel movements work easier.
So I was young, so obviously I didn't really report back to my doctor, which I should have, which you should do when you get complications or side effects of medication. So what I found that works for me is the off-the-counter medication. That is, I found it a little bit lighter, and especially the oral liquid one.
Which one did you take?
Blodsaft. It's called Blodsaft. It's basically like a drink that is loaded with other types of minerals and vitamins and C vitamins and a lot of iron. Some people don't like it because it's kind of tastes like iron. I actually, myself, I like the taste. But I guess what I'm trying to say is that it's the diet and the supplements. You can come a long way with that, but you still have to go back for, I go every year because of my hypertension. I go for checkups. So compliance, and make sure go for a follow-up.
Exactly. But I just realized that you actually stressed something else when we were talking behind the camera, so to speak. When I was a child, we lived in the north of Sweden, and I realized after some time that the meals we got at school, they were thought through. And we know that also young people can have iron deficiency, but we don't check that so much. But they were very careful that the food at school was nutritious. So you would eat food that contained a lot of iron. One of them was the typical Swedish blod pudding, which is actually made of blood. Not my favorite. But it would be served with a salad. And what kind of salad would it be served with? It would be served with a cabbage salad that was dressed with a kind of orange dressing or something like that. And that was just so rich in C vitamin. And you have a point there, that you have the C vitamin. When you take your iron tablets, make sure, gulp it down with some orange juice. Why not? But it's the C vitamin helps the body pick up the iron from the tablet and from food that has a lot of iron in it. So that's definitely recommended. Definitely.
But obviously, this is not a food that we recommend to everyone, because it's it's basically pig blood. It's just a typical Swedish food.
It's typical Northern European thing. They do have it.
Liver.
Yes.
Cow liver, chicken liver.
Chicken livers. Chicken livers. I know a lot of people eat chicken livers, eat cow livers. That is excellent food I know in some cultures even they'll give chicken liver to the mother when she had just given birth to her child. That's another point, by the way. You have pregnant women also get anemia. That's typical.
That's very common.
But there we're much better at checking up their values. And I also have noticed that we do have women who have a vegetarian diet. A lot of people from the Far East, people over here in Sweden who are vegetarians, who don't eat any meat at all.
Environmental friendly people that
too, and vegan, of course.
Vegan.
And I actually had one patient who taught me something interesting, which I've later on heard is true, is that there are certain specific grains, seeds that have iron, and one of them are actually pumpkin seeds. So when she was pregnant, she had 2 children. She said that she ate a spoonful of pumpkin seeds every day, and that kept her going. And I was amazed. Maybe I wouldn't recommend everyone to just have pumpkin seeds. They're good for your stomach, on the other hand, and do help you with constipation. That's those kind of things that are good to know.
I love them I basically sprinkle them on my yogurt. I love pumpkin seeds, especially if they're oven baked, roasted in the oven. So I learned something, like a trick. So during the summer is really short in this country, but there are weeds that grow. Nettle, I believe they're called.
Yes, nettles have a lot, but they're actually, the amount of iron in them, I think, is more or less like spinach.
Spinach. So if you eat spinach, you don't have to go out.
Spinach is a classic. Have you ever seen Popeye?
Pot pie?
Popeye the sailor.
No.
He
Not
eats
really.
Spinach. He's a man, on the other hand, so he doesn't lose any blood bleeding.
Exactly.
But he eats lots of spinach and he keeps him strong. And there's something that's true about that, because that was like somehow in the beginning of the 1900s, Popeye turned up, and that was a way to teach children to eat spinach. Because not everyone could have a steak for dinner, but spinach was around for everyone. You eat your spinach and you'll be strong.
And you also mentioned how we cook our foods.
Oh, yes.
To get iron.
Yeah, in Northern Europe, but also in other places in the world, you can use skillets or pans that are cast iron.
Yeah.
Now, cast iron is pure iron.
Yeah.
And you can't bite the skillet. But what you do is when you cook things in the skillet, a bit of that iron diffuses into your soup, your stew, especially if it's slightly acidic. Say you have a tomato stew or a tomato soup that's slightly acidic, it will pick up a bit of iron. And one knows that this is another way of getting iron, and it's not dangerous at all. It's not toxic in any way. It's quite interesting.
So there's so many other ways, tricks and things that you can get iron. So let's talk about lifestyle and prevention. We talked a little bit about vegan people, people that have a vegetarian diet, and I know people that are very much aware of the environment these days everywhere, to make sure that we don't consume too much meat because it's not good for the environment. So how can we prevent anemia through our lifestyles?
I think it's a lot to do with diet, basically. I mean, even if you don't eat meat, I do find that it's not so that you, per definition, have anemia because you're a vegan or vegetarian. Because I meet a lot of vegetarians and vegans who know very well what to eat, but you have to have that knowledge. Yeah,
exactly. Because a lot of people kind of do it as a thing, that is trending, as a trend that they want to hop on, and it's not just to cut out the meats and not replace it with something else. So basically, do your due diligence and do your homework.
True, definitely.
And replace it.
And then the tricks of the trade, that you know exactly that you need a certain amount of this and that, whether it's pumpkin seeds, boiling in your skillet. And of course, actually, if I'm to be quite frank about the medication in terms of stopping bleeding, I know a lot of women can feel very hesitant about using hormones. And when I suggest that they go to gynecologist and the gynecologist suggests hormones, for example, contraceptive pill, they don't feel like they want to do that. And I often ask them to rethink again, just in case. There is actually even an environmental aspect to hormones, because the hormones we eat, we actually do they leave the body in our urine, a lot of it, and goes out in the rivers and our waters. So I have had a patient mention that, and that's also an aspect. But that means you have to be
well-read.
Yeah, you have to be aware of what you do with your food and how you eat. And there's no cheating there.
There's no cheating. Yeah, nourish your body. But I feel like it's so interesting how amazing our bodies are, because for what happens with us women when we are on minus, there's a way that our body still compensates and helps us.
We're serviceable for everyone except ourselves.
Yeah, but it's amazing. Our bodies are amazing, and we should take good care of them. So a good diet.
A good diet.
All right, so special cases. Do we have any special cases? Let's talk about your experience with your patients. Which ones have really been the specific cases? Because I have an example of one of the patients that you sent to me and explained to her what really was happening in her body and how she could prevent it. So let's talk about special cases. Do you have anything in particular? Anyone that, you talked about someone that taught you something, but can you think about this? Because you were so passionate about these girls and how we shouldn't forget them.
I still am.
Yeah, you are. I can see that. So tell us, do you have anything to share?
It is, I think that the young girls are the ones who could be my daughters these days.
Yeah.
But also older, who just, there's the one I mentioned who came to me, a fit woman, I think she was in her late 20s, who had chest pains when she went to the gym.
Yeah.
And who felt that everything was tiring her. I have several patients that I've met, and usually women, I'm sorry to say. Well, no, I don't want the men to get anemia, that's not my point.
Yeah.
But I'm sorry that it's continuously the same thing I see. You can have the young woman who doesn't understand why she's so tired, why she gets chest pains when she goes to the gym, and will come to me, and it's the anemia she has, what we call a blood count. In England, you'd say 8.0, but with us, with 80 or less. And the interesting thing is they can come with blood levels so low that if it would be an older person who had that, or if this would happen to them very fast, they wouldn't be standing on their feet.
Yeah.
They would be lying in the bed, they will be fainting. But because this happens slowly in the body gets used to it and acclimatizes somehow, and so you don't think of it that this can be something that's wrong. Well, the special cases, I have someone I know quite well who for a long time found that it was her body hurt when she went to her gym classes, to her dance classes. She found it difficult walking upstairs, but she never spoke to anyone about it because I guess she just thought it was part of life.
Normalize it.
Yes, she'd come home and she would sleep.
Yeah.
And sleep.
That's what I did.
And she would sleep. She went to school, she came home, she slept. The weekends she slept.
I so recognize that.
And then at some stage she started getting really bad headaches. So the question was, is it a migraine? What is it? Took some medication, but the headaches wouldn't go away. They just wouldn't go away. And otherwise, a jolly person. And this person also got so tired that she started feeling anxious all of the time, that it affected her mental health.
Yeah.
And that's not commonly seen, but I do see it, that when you have anemia that is so bad, you're so tired that you can't think straight. And you start getting anxious, you start getting depressive. And it turns out it's the anemia.
Yeah.
You fill up that iron, and it takes less than a month, and the person is in a much better state, but has been through so much, I would say, suffering.
Yeah, that was me. That was definitely me. And I
didn't know your story.
You didn't.
So
you didn't. So it was a long time ago. I was young, and that is why it's so important to get this information out there, because a lot of us get it really young, and it depends on your lifestyle, obviously. For me, it was something that I accepted very quickly and learned. I did, my homework, and then, I just went on with my life. But I realized, that time coming to getting a diagnosis, it was really hard. I was so tired. I I couldn't do anything. I couldn't focus, just like you're talking about. I couldn't focus. I just wanted to sleep all the time. And what hurts me is that I wasn't really taken serious, because when I called up my midwife and told her that, you know, I suspected this was the reason why I was bleeding, and I think this is why I'm feeling so tired. It wasn't, like I said, it wasn't an emergency. So she just brushed it off and said, you know, you can come to me on an appointment when I have time. So, and this is why I, you know, press on, you know, the women's health and taking us seriously, listening to us, and yeah.
I feel so bad when you say that, but at the same time, this still happens to so many women.
It still happens.
And I see it on a weekly basis, I want to say.
Yeah. So the special case that I have is a patient that you sent to me, and you did it so well. You explained to her. So when this iron deficiency gets so far along, basically, so very dangerous, is when you lose those reserves. And what you said to her, I remember, because she came into me and I had to give her the drip, the iron drip, and you explained to her that if she got into a car accident and lost a lot of blood, she wouldn't have any reserves to replace the blood that she had lost, and that would be so. I guess that she understood the way that you
explain it.
You explained it so well, and she explained it to me, and we had this conversation and we discussed it, and she got it. She got it, and that led to her accepting her diagnosis and her treatment, because she was very reluctant to getting the drip, from what I understand. That's
true, actually, now that you say it, because I have too many patients with anemia.
I know, you probably don't remember, but I remember.
And sometimes they're reluctant. They say, why do I have to do this? Or they think, so what, do I have to take these tablets for the rest of my life?
Exactly.
And they don't initially, at least, understand that this is something that's just not now. It will come back if you don't do anything about it. And those reserves, I think that very many of those people I meet, they will have no reserves. You have to fill them up.
Yes.
And just as you say, another way of getting anemia is a car crash or an operation.
Yes.
Or something acute that happens. You get sick and you have no reserves.
A C-section.
C-section, very much so, yeah.
Yeah. So we have to be really mindful and really think about, you know, our symptoms, not maybe self-diagnose, but still go to your Anna, your general practitioner.
Well, first of all, because there's a lot you can do about it. I mean, if you can't do anything about it and you say it's fate, fine, but this is not fate. You can do something about it.
Yeah. Thank you for explaining that. So anything you want to add about anemia that we should think about?
Girls, be strong and take care of yourselves.
Yeah. Do it. Take care of your bodies. Through diet, through going to your doctors and actually getting assessed.
Yes. I mean, and if it's something else, so be it. Good, but you've done that checkup.
Thank you for highlighting that.
Thank you.
Thank you so much for coming. It was such a pleasure having you. And I hope you come back.
Oh.
Thank you.
What should we talk about that time?
Oh. Let's talk about it. Thank you so much, everyone, for watching. And I hope to see you in my next video. Please do not forget to subscribe, like, and comment. Ask Anna something, a question. Do you have any questions about anemia? Do you have any questions about treatments or anything else? Just pop those questions in the comment section and we'll make sure to answer them.
Maybe we should have a follow-up.
Maybe we should.
Yeah.
About anemia.
About anemia, when answering questions.
We should. A Q&A on anemia.
Good. Yeah.
Yeah, let's do that.
Good.
Thank you so much for watching.
Thank you.
Bye.